see you again. Good afternoon, ladies and gentlemen. My name is Nirav Shah, and I am the director of the State of Maine Center for Disease Control and Prevention. Happy to join everyone today to provide an update on the COVID-19 situation across the state of Maine. We begin today's briefing with some unfortunate news. Maine CDC is aware of the passing of an additional Maine resident who was diagnosed with COVID-19. The individual was a female in her 70s from Cumberland County, and her passing marks the 52nd death associated with COVID-19 across the state. As we always wish and always hope, all of us at Maine CDC offer our deepest condolences and best wishes to the family of this individual during this time of their grieving. Overall, Maine CDC is reporting 1,056 cases of COVID-19, an increase of 16 cases since yesterday. Of those, 166 have been hospitalized at some point during their illness, an increase of 3 hospitalizations from yesterday. Right now, there are 17 individuals across the state who are in intensive care units with COVID-19 and 15 individuals in non-intensive care unit beds. Overall, those 32 mark a decrease of 1 since yesterday, and 7 individuals remain in Maine hospitals on ventilators. As I mentioned, we've now marked the 52nd passing of an individual with COVID-19, and now 615 individuals have been declared to be recovered. That's an increase of 30 since yesterday. Overall, there have been 247 healthcare workers diagnosed with COVID-19 as well, and we continue to offer them our deepest thanks. Every single day, they are running to the front lines at a time when many of us are staying home. And as they do so, they are helping to keep each and every one of us in Maine, and speaking from personal experience, our family members healthy at a time of pandemic. I just want to offer a personal thanks to those healthcare workers, not just those in the hospital, but as well as those who are out in the field, EMS workers, paramedics, other first responders who come to people's homes, take care of them while they're sick, transport them to the hospital, and each and every one of those folks in a hospital that's keeping our loved ones safe and healthy during this time. I really do thank you all. Overall, there have been 19,546 negative tests on Maine residents. That's an increase of 2,762 negative tests just in the past week. When you combine that with the total number of positives, just last week alone, there were nearly 3,000 Maine residents who received a COVID-19 test. That's just in the past week. We, of course, have more work to do to increase the number of tests that are offered, as well as the overall capacity to conduct that testing within the system. But we are seeing signs of progress on both fronts, and we hope to continue that progress as we go forward. I'd like to just walk through the numbers with respect to the outbreaks that Maine CDC is working with and tracking at long-term care facilities across the state. At the Augusta Center for Health and Rehabilitation, there are now 48 residents and 28 staff who have been diagnosed, and sadly a total of 5 individuals who have passed away. At Falmouth by the Sea, there have been 21 residents and 12 staff who have been diagnosed with COVID-19. At the Maine Veterans Home in Scarborough, 31 residents and 20 staff, and sadly 12 individuals who have passed away associated with that facility. At the Tall Pines facility in Waldo County, there have been 32 residents and 11 staff and 11 individuals who have passed away. And at the Cedars in Portland, 10 residents and 5 staff who have been diagnosed with COVID-19. And finally, at Edgewood in Farmington, there have been 9 residents and 5 staff who have been diagnosed, and 1 individual who has passed away. Overall, just looking at the long-term care facilities where outbreaks have been found, a total of 151 residents and 81 staff have been diagnosed, and sadly 29 individuals who have passed away at facilities where we have detected outbreaks. I'd also like to provide an update on 2 additional outbreaks where Maine CDC has been actively working. The first is at the Hope House in Bangor, where there now are a total of 20 individuals who have been determined to be positive for COVID-19. Just a few hours ago, about an hour and a half ago, Maine CDC received word that of those 20, 16 are new and have just been diagnosed. Previously, Maine CDC was aware of a few cases, and as a result of those few cases, recommended universal testing, as has been our practice and as something we've talked about. We like to get a bird's eye view on everything going on in a facility, and have thus recommended universal screening to every one of the residents and staff affiliated with the Hope House, consistent with our practice in other situations. We just learned that there are now a total of 20 cases. I'd like to be very clear that these 20 cases, especially the 16 new cases, are not reflected in today's total. They will be reflected in tomorrow's daily case count, but they are not reflected in today's case count. The daily case count that I report has a cutoff time of midnight. These numbers will be reflected tomorrow. However, in an effort to be as transparent as possible, to relay information to everyone in the state as soon as we are aware of it, I wanted to report those numbers today. So again, to recap, at the Hope House in Bangor, there are 16 new cases, bringing the total to 20. There are also tests that are outstanding, and as we receive those results throughout the day, that number may be higher tomorrow, and in any event will be recorded and reported in the number of total cases that Maine CDC reports tomorrow. But in an effort to provide quick, timely, and transparent information, I wanted to discuss those case counts today. I'd also like to provide a briefing on the situation that Maine CDC has been working very intensely on at the Tyson food plant in Portland. Maine CDC has become aware now of a total of 8 cases affiliated with the Tyson food processing plant in Portland. Each and every one of those 8 individuals is not working right now. Over the past 24 hours, Maine CDC has had a number of very productive, collaborative discussions with our colleagues at Tyson and have made a number of recommendations to the Tyson food plant, including, as we've talked about, moving toward universal testing, which is truly one of the core tenets of the approach that we at Maine CDC are taking. I'm grateful for this close cooperation and collaboration that we've seen from Tyson Foods. As it turns out, they were already heading in the same direction that Maine CDC has offered recommendations on. And much of the recommendations that we offered were things that they were already contemplating doing. We're grateful for that close collaboration and cooperation. As we receive testing results that our colleagues at Tyson are undertaking, we will report them to you as we know more. This is information that is quickly changing. Those numbers may quickly change. And again, we will keep everyone updated as those numbers change and as we report more as for all of these case counts. I want to pause before I turn to a discussion on PPE to just reflect for a moment on these case counts. Every single day, I endeavor to come here and talk about every one of these case counts. But I also think it's really important that we each remember that each of these cases, as I've mentioned, is a person. And behind each of these numbers is a separate set of numbers. And behind those separate sets of numbers, when you get right down to it, represents an individual, a family, a community member, a spouse, a parent, a family member, or a friend. And as these numbers continue to increase, it's inevitable that each of us will be affected by COVID-19 in some way, and for many of us, different ways. Some of us may personally get the disease. Others of us may know someone who has been affected. And for many of us, our friends and family may be displaced in some way or have a health concern related to COVID-19. As we think about these numbers in big picture terms, I ask everyone to keep in the back of their mind that although we talk about case counts, I ask everyone to remember that every case counts as well. I'd like to turn now to provide an update on where things stand with our distribution of personal protective equipment and our supplies of personal protective equipment. One area that has been under national concern for shortages have been the swabs that we use to actually conduct the tests for COVID-19. Just today, Maine CDC is receiving a shipment of 1,000 swabs from FEMA Region 1. Those swabs will be arriving in our warehouse, and we'll be able to distribute them to individuals and healthcare facilities that are out there, again, on the front lines doing this testing. I'd also like to provide an update from our friends at the National Guard. Last week, I talked about how the men and women of the National Guard had volunteered their time to take on a mission to get additional healthcare workers in Maine fit tested. For without this fit testing, individual healthcare workers can't take full advantage of these life-saving N95 masks. The fit testing process is the gateway that they need to go through before they can be issued an N95 mask. Since the National Guard men and women received training, they have then gone on, and just actually yesterday, not in the past few days, but just yesterday, the men and women of the National Guard have fit tested an additional 51 staff, 34 of them at Tall Pines and 21 of them at Cedars. These are now 55 new healthcare workers in Maine who can be issued N95 masks and have the security that that mask provides. Again, I'd really like to take a second to thank and call out and give a shout out to each and every one of the men and women in the National Guard who have undertaken this mission and are allowing more folks to be fit tested out there so that we can make better use of the vital resources that we've got. Today, Maine CDC, working with our colleagues at the National Guard and the Department of Transportation, are shipping out over 11,000 pieces of PPE just today alone. About 75% of that PPE is going to congregate care settings, places like nursing homes where our family members live. And the remaining 25% or so is going to first responders at the community level, local-based fire, rescue, and EMS providers. They'll be receiving another distribution as well, and all told, about 11,600 pieces are going out just today. Just to review the inventory really quickly of what Maine CDC has on hand. Right now, we have nearly 180,000 N95 masks on hand, approximately 100,000 surgical masks, 8,000 face shields, 50,000 gloves, 1,500 disposable protective suits, and about 4,200 surgical gowns. And I already mentioned the 1,000 nasal swabs that we have received or will be receiving today from FEMA. Overall, since we began our distribution of PPE, Maine CDC has fulfilled 1,283 orders for PPE from healthcare institutions across the state. We will continue to do so to make sure that our healthcare workers on the front lines have the PPE that they need in order to stay safe. I wanted to pause there and just reemphasize that our priority for pushing PPE out the door is to get it in the hands of first responders, frontline healthcare workers who are taking care of individuals who are known to have COVID-19 or who may be suspected of having so. That has been our priority from day one, because having those healthcare workers being able to show up for work and know that they can stay safe, that's an obligation that we at the Maine CDC have, and it's one we continue to intend to discharge each and every day, is to keep those healthcare workers safe, and something that we will do as we move forward with this outbreak. Finally, I'd like to close by just acknowledging a couple of donations that we've received in just the past few days that I haven't had a chance to acknowledge. I'd like to first start by giving a big thanks to our friends and colleagues at the York County Emergency Management Association. Just in the past few days, York County has donated to Maine CDC a large cache of N95 masks, not just to Maine CDC, but to MEMA as well. They've also donated 600 face shields on Monday, and we're continuing to work with York County. As they have excess PPE, they are able to donate it to us in the event that we may have others across the state that may need it more urgently. I really would like to thank our friends and colleagues at York County EMA for these donations of PPE, especially during this time of need. I'd also like to give a big thanks to our colleagues at the University of New England. I've talked recently about fit testing and how you need to go through this fit testing process before you can undertake wearing an N95 mask. There's a lot of things that are needed for fit testing. You've got to have someone trained to do it. Thanks to the Guard for helping us do that. But you also have to have on hand a supply of solution that can be used to see if people can smell that solution. If they can smell it, it means the mask isn't a good fit. That solution has been nationwide in short supply. That's why I'm delighted to announce that the University of New England just yesterday donated to Maine CDC 65 bottles of this testing solution that, again, has been in national short supply. These 65 bottles will allow us to go out there and fit test even more individual healthcare workers, again, so that they can be equipped to wear and use these N95 masks. I very much thank our colleagues at UNE for this donation. It comes at a time of national shortage, and rest assured we will use that with healthcare workers to get folks fit tested so they can take advantage of N95 masks. I'd like to close by noting two things. The first is there's been a lot going on recently. And just even on a personal note, my family has had personal firsthand experiences with the healthcare system. And I'd like to just take a second to acknowledge again each and every healthcare provider out there, as well as everyone across the state who plays a role in supporting those healthcare providers. When something unforeseen happens, whether it's an emergency or an accident, I think each of us has in our mind, as we're contending with the worst case scenarios, we also have in our mind some view, some vision for how we hope things turn out. For how, when we dial the EMS system, what's going to happen when the first responders show up. And when we get to the hospital, how smoothly everything we hope will go. And when nurses in the ER show up, how we hope that they will treat our loved ones with compassion. And how, if something more intense is required, how we hope that that will go. We all have that playbook, that vision, that ideal in our head that we hope comes to pass, even as we're facing down an emergency. And I'd like to just take a moment to thank not just every healthcare provider, every first responder, but everyone who enables those folks to go to their jobs every single day, every spouse, every partner, every member of those support staff who allow those healthcare workers to go to the front line in difficult, challenging, risky, troubled times. I'd like to thank you for providing that support across everyone in Maine. Again, we all have this vision for how we hope things might go in the sake of an emergency. And when that time comes, we hope that's the path it goes down, and not the catastrophic thinking that invariably enters our minds when difficult situations arise. Thankfully, that's the path that my family and I went down, the path of everything we hoped happening actually transpiring, even though we faced a difficult situation. And we were able to go down that path because of the men and women across the state of Maine who each and every day choose to show up for their roles in our healthcare system. Bad things happen, accidents transpire, but how we respond to them is really what differentiates us as a state and as a community. And so I'd like to thank everyone out there. At a later date, I'm going to take some time to write thank you notes, but for the time being, please know that there are a number of people out there who have really, truly helped my family, and I thank them for that. So with that, I'm joined today by Commissioner Heather Johnson from the Department of Economic and Community Development. Commissioner Johnson and I are delighted to take our questions from our colleagues in the media. Today's first question goes to Brian Sullivan from WABI. Brian, go ahead. Your line's open.
Thank you, Dr. Shaw. I have a question for both of you. I would start with you, Dr. Shaw. Can you just take us through the next steps that will be happening at the Hope House here in Bangor on the CDC's end, and will they still be allowing people to stay there overnight? And for you, Commissioner Johnson, I just was wondering about these checklists that a lot of retailers and businesses are hoping to get, and if you could just provide a little information about them for the path to reopening, and in the end, how these checklists will be checked and how they would eventually be enforced.
Great. So Brian, Brian's first question is around Hope House and the pathway forward with Hope House. For some of the particulars, Brian, I would probably refer you to Penobscot Community Healthcare and Hope House themselves. But in general, our approach to situations of this where outbreaks may occur in shelters for people experiencing homelessness is as follows, and these steps have already been taken. The first is that when individuals test positive, as many have, they are placed in separate locations so the risk of infecting other individuals who are negative is lowered. We also, again, are continuing with analyzing the tests as well as the test results so that our epidemiologists can conduct contact tracing and see if there are others out there that we need to be in touch with. For the specifics around who's residing where and what tonight might look like, what the subsequent nights might look like, I would probably refer you to PCHC for the particulars. But please know as you do so that we have been and continue to be working very closely with PCHC, with Dr. Noah Nesson, with Lori Dwyer, with their entire set of teams, and have been working hand in glove with them. We're delighted to have that partnership. Again, when bad things happen, what really matters is how we respond to that. And in this situation, we've been delighted to be working with our colleagues at Hope House because they've been at the ready to keep their residents and their shelters safe. Commissioner Johnson?
Yes, thank you, Dr. Shaw. So I think the other question was about the checklists. So the prevention checklist for phase 1, so the sectors that are part of this first stage, will be posted tonight and available to businesses to go in and read through and download. Those are available, like I said, will be available later today. Checklists for later stages will still be in the works. So we are still working with private sector and other resource providers to get feedback, to develop processes, to work with Commissioner Lambrew's healthcare team, as well as the business community to make sure that we can find kind of the safest processes that are available, and then those will go up as they're ready.
Great. Thanks, Commissioner, and thanks for that question, Brian.
I just had one more follow-up for the Commissioner, if that's all right.
You bet.
Just with that checklist and when it being available tonight, can you explain the process for maybe checking things off the list and who's in charge of making sure that that's actually happening at these locations?
Yeah, thank you. That's a great question. You know, what we've seen is a really good partnership with the business community. And so we are all of the discussions we've had with the business community have been very focused on their interest in keeping themselves, their employees, and their customers safe. And so as part of that, we are very confident that the business community will take the appropriate action. We'll also make these checklists available so consumers have the information and can also help guide themselves through this process as well. Certainly there will be a process if anyone feels there's a violation that happens, we can go out and do some educational work and some calling. Again, I think the checklist piece is just a set of guidelines for people to be able to operate their business in these difficult times and to try to keep people as safe as possible.
Great, thank you. And we'll turn next to Brad Rogers over at WGME. Go ahead, Brad.
Yeah, a question for each of you. First, Commissioner Johnson, on July 1st, when hotels open up, will the quarantine in place order be lifted for people coming into Maine? And if not, how's that going to work for tourists staying in hotels? Plus, when will the dentist's office open back up? Do you know?
Yeah. So let me take the first one first, because there's been a lot of discussion about tourism and some of the work. It's a long time between now and July 1st, right? And I think if we look back on the last 30 days, a lot of things have transpired over the last 30 days. A lot will transpire over the next 60 as well. We are trying to find multiple options for tourism businesses and people who want to come to Maine to find a way to do that. Quarantine is a last case choice. We are actively working on some other choices that we aren't ready to be able to talk through yet. But yes, I think there will be choices. Again, we just think it's really early to be able to have some of that discussion yet.
Mm-hmm. And Brad, you had a question for me?
Dentist office. Yeah, dentist office. So dentists are part of the elective medical procedures and are part of stage 1.
As a drinker of Diet Coke, I am particularly focused on when my dentist office will reopen. Brad, you had a question for me?
I did, and actually it's maybe for both of you. This is actually a viewer question that I've got here coming in. And he wants to know, with most of the new cases over the last 14 days being in Cumberland and York County, and 10 counties having fewer than 20 cases, he'd like to know if the state will consider accelerating the stages in those counties with very few cases, and if not, why?
Yeah, so if you don't mind, I'll start and you please jump in, because this is a very collaborative body of work that we're trying to work through, right? How do we keep people safe and get the economy moving as quickly as possible? And it's a delicate balance that we work together on to try to achieve. So definitely there is a body of work going on around rural communities, looking at population density, risk, safety, those types of things. We do believe that there is opportunity to pull forward some of the stages for some of our rural communities. We are working through that actively, but don't have a good update on the specifics for that today for you.
I agree. I don't have anything to add on top of what Commissioner Johnson noted. We'll turn next to Steve Missler over at Maine Public. What do you got, Steve?
A couple quick ones. Well, I'm going to start with you, Dr. Shaw, if you don't mind.
Sure.
If you missed it, I apologize, but did you say if the CDC has deployed universal testing at either or both Hope House or Tyson Foods? Just curious if you guys if that's part of the protocols. I know Tyson's Food is a little bit different than long-term care facilities, obviously, but if you have people there, 8 people there, it seems like testing as many people there as possible might be a good way to go. And
the answer to your question, Steve, is yes. We have recommended it at both, and both facilities, as you saw from Hope House, they have already undertaken it, and Tyson is in the process and was going in that direction in the process of arranging for it now. And as you know, structurally speaking, there's not a lot of difference, and so this is, universal testing has been one of our tenets from early on. Maine was leading the way with respect to universal testing in long-term care facilities, and we're now replicating that under the same theory in non-long-term care facilities as well. So the answer to your question is yes.
Great, thank you. And for Commissioner Johnson, I just had a question about the I guess lodging between phase 2 and 3. It looks as though phase 2 is lodging for Maine residents but it's not clear from the release issued yesterday whether lodging includes hotels, which is mentioned specifically in Phase 3. If it's actually included in Phase 2, then that kind of renders my question moot. But if it's not, and there's a distinction between the two, I'm wondering what the thinking was behind opening up hotels in Phase 3 but not Phase 2.
Yeah, I apologize. I think that was probably just different language, different words being used on different slides. We can certainly go back and adjust that. Lodging for June is Maine residents, and then lodging in July and August is when we are trying to expand that work, again, using some safety protocols that are in the works.
Great. Thanks a lot, Steve. We will turn now to Don Kerrigan over at News Center.
Yes, good morning, good afternoon, rather, Dr. Shaw and Commissioner Johnson. With all respect, Doctor, I've got a couple questions for the Commissioner. The first is a simple one. Different openings, June versus July, for bars and restaurants. Knowing that many places have a bar and food in them, how do you define the difference, since a lot of bars have kitchens and serve food? Then I've got another question regarding the out-of-staters. So if you want to answer that one first, then I'll ask the second.
Great. Yeah, thank you, Don. This is a really good question. And so as we look at these, right, we are trying to find commonality. And I think work toward commonality and then handle the anomalies separately. So restaurants are fairly clear. Bars are fairly clear, but there is this hybrid group that are restaurants and bars. And again, I think we are trying to work closely with the private sector and the healthcare committee to figure out what is appropriate there, how would we create that delineation, and what could happen in each that would be deemed safe and when. So, you know, we continue to work on that. They are included in the stages because that's kind of the vision of what the plan is, and for people to be able to kind of start thinking about that. Certainly there's a lot of work to be done there on the individual specific components.
The other question has to do with out-of-state travel, the 14-day self-quarantine, and a bunch of questions arising from, does this mean that people who have a cottage or camp in Maine can't come from out of state for the weekend? What about coming here to camp in the woods? If any summer camps do open, can out-of-state kids come there? And what will be the enforcement for this, or is it just going to be on the honor system?
Yeah, so that's a lot of questions, and I invite Dr. Shaw to jump in here with me on this one. The intent on public safety is the priority here, and keeping Maine residents safe is our first duty. Our immediate second duty, obviously, is to keep the economy running so that people have an opportunity to support their business and their livelihood, and we're trying to find that balance very carefully. The quarantine piece is what's available to us today. Science is continuing to evolve, and we know we have a little bit of time between now and when we expect more more people to want to come to Maine and us to attract more people to Maine. We are working closely on that science as it evolves to find different solutions than a 14-day quarantine. Right now, a 14-day quarantine is kind of the only solution, or the primary solution. We see line of sight to other potential solutions, but there's a lot of science that needs to happen between now and then.
Yep. And Don, I would build on top of what Commissioner Johnson says by noting first, as I think about this, I think it's important to note that really these are questions that at no time, at least in modern history, has society ever really faced. We've never had to grapple and come up with a theory for in what ways to open businesses after a global pandemic. And so this is a brand new set of questions, and we are using the best available scientific tools. Right now, the approach that we've taken is one that is trying to balance safety as well as restarting the economy. As Commissioner Johnson noted, the quarantine tool casts a very, very broad and wide net. And as a result, it's going to be a bit over-inclusive. Our goal is to try to come up with a more targeted, more finely refined and defined approach to how we can target individuals who are coming in the state. What that looks like somewhat depends on what some of the scientific data tells us about testing strategies and ways to keep people safe. no one has really come up with an answer to any of these questions, not right now, not really ever. So we're continuing to look at the science. What we know today may be different from what we know 2 weeks from now. And if that scientific landscape changes, we'll adjust our response.
And I would say, Don, too, that we are actively working on that with partners. So we aren't waiting for the science to happen or hoping somebody else solves the problem. Dr. Shaw, Commissioner Lambrou, and her team and our team are working actively with private sector companies in the science space that we aren't able to talk about yet to help get to a solution for tourism.
One very quick follow-up. As you know, Memorial Day weekend is what? Hard to believe. 4 weeks away. That's always a big weekend for people to come to Maine for the weekend, whether they're camping, going to cottage, whatever. Does this pretty good chance that you're going to say they can't come?
I think there's a. Do you want to take that one?
No, go ahead.
So I think Memorial Day weekend is always this great start, right, to summer in Maine. And I think we are trying to figure out what can we do safely to keep Memorial Day, some of the Memorial Day kickoff options available. Things like, and we haven't kind of gotten there yet. I do think it's unlikely that Memorial Day will be anything like Memorial Days of the past. I think it's unlikely we will have widespread tourism access by Memorial Day. Having said that, there may be some smaller things that we can get to agreement on by then, and we are working through those.
Thanks a lot, Don. We'll turn now to Kevin Miller over at the Press Herald. Go ahead, Kevin.
Hi, thanks again. So first, a question for the Commissioner, and then one for Dr. Shaw. Commissioner, is there any flexibility, and this follow up a little bit on Don's question, I think, really, is there any flexibility in a list of businesses that can open during these various phases? So for instance, if you have a small business that feels like they can demonstrate they can operate safely, but they're not in those lists in the phase, can they petition your department to open?
Yeah, I appreciate the question. Absolutely. I mean, this plan is built on flexibility and kind of working with the private sector and coming to solutions that offer safe options for businesses, for employees, for customers, and for the public. So absolutely, we encourage people to kind of reach out and work with us on what might those options look like, how could this happen, and we welcome that. There's actually a link on our website on the DECD page that was being used for something else and will be transitioned to that. So later today, people will be able to see where to go to make those requests and initiate that discussion.
Great.
So those lists that came out yesterday, those aren't hard and fast lists for each of the individual phases. Different businesses in different sectors could potentially ask to be able to open.
I think we are open to considering everything that we think is safe for the public, and trying to work our way to, always that guiding balance of safe for the public, keeping the economy running. I think we are obviously looking very actively at rural differentiation as well, so we expect to maybe have some of those discussions with businesses too. So yeah, we look forward to those discussions. As you look at that list, it's not even comprehensive, right? It's clear that there are industries that aren't specifically aligned to any stage. So we expect to be able to have that dialogue actively with resource partners and with the private sector.
And Kevin, you had something for me?
Yeah, Dr. Shaw. So looking at the Tyson Foods outbreak, there's obviously been some large, national cases of food plants that have even had to shut down because of outbreaks. Can you just tell me who makes that call? Is that the business? If this outbreak was to continue, is that the business's decision about whether to shut down, or is the Maine CDC? And correct me if I'm wrong, this is the first large-scale, or not large-scale, but larger outbreak that we've seen at a business other than a healthcare facility or a long-term congregate care facility, right?
So as to the latter, Kevin, I believe you are correct. Outside of a healthcare setting, this is the first such outbreak. There have been cases that have been reported in other workplaces, but they didn't rise to the level of an outbreak. But if that's based on my recollection, Kevin. If I am incorrect about that, then you'll get an email from Robert correcting me on that. But that's based on my recollection, just scrolling through to make sure there's not one that I'm missing. but I don't recall so. And as to the former question, so I'll take a step back. We've learned by watching the outbreaks that other states have contended with in poultry and meat processing facilities in their states. That's one reason when we first heard about this, not only did we hop on the phone immediately with Tyson, but also did not want to delay in making recommendations with respect to universal testing. Now, with respect to idling the facility, we actually just had a call with them at 1 o'clock, so just not even 2 hours ago, to discuss that very issue. They are open to going in that direction as well. There are various trade-offs that I will be clear about that we brought to their attention. Our goal in this endeavor is twofold. Our goals are twofold. The first goal is to test everybody. But there's a secondary goal, of course, of preventing further spread within the facility. If we close down the facility and no employees are showing up, it makes it harder to do the first goal, which is to test everybody. So there is a bit of a trade-off there. And so we are working with the facility in order to find a way to idle the plant so that so workers can still show up, maybe not do the job that they previously would do, but perhaps something else, and still have an opportunity to discharge our first goal, which is to get everyone tested. In terms of who the ultimate decision maker there is, Kevin, it's a collaborative effort. And ever since we've first been in contact with Tyson, it's been very collaborative. So it hasn't really come down to a thou shall. It really has been a we recommend and they concur. And in fact, in many instances, they were already working on those issues and have already consulted with their public health consultants and were on the same page with us to begin with. So I certainly don't want to portray this as a us versus them or an us commanding. They have already been thinking about these issues. And when we've gotten on the phone, it's been very collaborative. I'd like to turn next to Amy Brown over at WERU.
Thank you, Dr. Shah. I have a question for each of you, but first, Commissioner Johnson, if the checklist website crashes, it looks like there's only about 24, 36 hours between the time it's going to be up and when those businesses are supposed to open. And so I assume there'll be a lot of demand for it. If it can't handle that level of demand, will the businesses still be able to open? And is it mandatory anyway? Do people who want to open have to go through the website, or is that only to get the badge to put on their doors to demonstrate that they have?
Yeah, so thank you for the question. I think there was actually I appreciate you bringing up the badge. So the badge is actually a marking tool for businesses. What we heard from businesses are, if we open, we want something that we can use with our consumers to say we're aligned and following all of the best safety protocols. And so we created that. That actually won't even be available until tomorrow. That's not a mandatory part of the process. That's if you want something to share with your consumers or your employees to show that you are part of the checklist and that you understand it and you recognize it. That's available to you. You don't have to use it. But again, we got that feedback from the business community. We also saw with when we were issuing out letters, people were using these long form letters as that. And so we thought there was a more efficient way to do it. So that's what the badge piece is. As it relates to the checklist, they will be up and live. We expect, and the IT group expects, that we'll be able to handle the bandwidth to the extent that we can't. We've had a number of discussions with other resource providers that potentially can help as a backup. It's also good, right, for other resource providers to be involved as part of this process. They, on a daily basis, help other businesses as well, and they can be part of the solution too. So I think we have a couple of choices there. If we do have a technology problem, we have other options.
Great.
But
Thanks.
Is it mandatory? Is that process mandatory for companies that want to open, or is it just mandatory that they follow the guidelines? Do they need to go through the checklist and sign off, or just follow those guidelines?
It's mandatory they complete the form and utilize the checklist. That part is the mandatory part, and the form and the checklist can be available in multiple options. Right now, they're available kind of on our website. You go to the website and download it. We are working on some other ways to be more inclusive with other resource providers because we think that will be more convenient for businesses. So we think we have a couple of choices there.
Okay, thank you. And Dr. Shah, may I ask you a question as well?
Absolutely, Amy.
Thank you. Governor Cuomo has been talking about opening isolation facilities, and at least one other state I could find has already done that, where they put people who've tested positive to quarantine so that they don't infect the rest of their family or whoever else they live with. Has the state of Maine discussed doing anything like that?
We have, Amy. Our focus has been not so much on individuals who have a current abode, although we recognize there's a need there. It's really been focused on people who are experiencing homelessness, where we have special facilities, special places for them. If they test positive, they can remain, they can be safe. Food and other social, mental, behavioral health services can be offered to them. Now, what other states have talked about doing is going a step in a different direction, which is for individuals who do have a home, but who may not feel safe there, providing facilities of that nature. The states that have gone in those directions are really states with an extremely high density of cases. Individuals or places of the country where the average home size may be the average size of a living room in Maine. And for many places in, say, Manhattan, that's the entire apartment. If you're asking two people to be there, one of whom might be a healthcare worker, if you're asking two folks to stay there, one of whom to remain isolated, the risk of the other person contracting COVID-19 remains high. But in Maine, the situation is thankfully different. Homes are larger, space is more plentiful. And so we haven't yet had to go down the pathway that cities like New York City or much more densely populated areas have had to go down. It's something we've thought about, but right now our focus on facilities and operations like that has really been focused on folks who are experiencing homelessness as opposed to those who already have a residence. And I should say that for folks who are experiencing homelessness, we do have a plan in place, a plan that we've exercised, a plan that we've implemented, so that when individuals experiencing homelessness are diagnosed, they are not just out on the streets. They have a safe place to go, and services can be provided to them to contend and help them through all of the challenges that they're facing, not just COVID-19 related ones. I'd like to turn next to Lauren McCauley at the Maine Beacon.
Hi, yes, thank you, Dr. Shaw and Commissioner Johnson. I have two questions for Commissioner Johnson. I'm hoping you can provide some more clarity around unemployment. If someone whose industry is now reopened chooses to continue to stay out of work because of health reasons or fear of exposure, will they still be eligible for state unemployment benefits? This doesn't seem to be addressed either on the Department of Labor website or the Restart materials provided yesterday.
You know, I'd actually prefer to defer that question to Commissioner Fortman. I believe she'll be here tomorrow, but we can also get that question to her and see if she can we can get a response out to you. Thanks.
Okay, great, thank you. And my second question, for workers whose childcare remain closed or who are expecting children to be in school through the end of June, is there any guidance or help from the state to support those families?
You know, childcare is a really good comment and discussion to have, I think. We're at just under 50% of our childcare capacity right now. Childcare has continued to be open. A number of, obviously about half of our providers have decided to close facilities in this period of time, partly because parents are home. And so they have made some other decisions. I think as we see businesses starting to reopen, we are talking to childcare facilities, and certainly Todd Landry at the Office of Child and Family Services is also working very closely with childcare facilities to get them the support they would need to reopen. And we are starting to see people wanting to reopen. And so I think that will go on a very similar trajectory to the business openings.
Great. Thanks, Lauren. I'll turn now to Michael Fern over at the Maine Edge. Go ahead, Michael.
Thank you, Dr. Shaw. Both my questions are for Commissioner Johnson. Commissioner Johnson, some businesses were funded for PPP weeks ago and recalled and began paying employees. However, those funds will run out in late May or June, and for those businesses in phase 3, they could have a gap of up to 4 weeks and end up having to lay off employees again. Do you have a sense of how the state or federal government is going to handle that? And as a quick follow-up, are the checklists required for essential businesses that have been operating and open all along? Thanks.
So I'll take the second one first, if that's okay. we have not created checklists for businesses that have been operating all along. We have been working kind of in partnership with them from the start to work on what are those protocols, what are the safety procedures. And so in the short term, we've turned our attention to new openings in order to really focus kind of this partnership between the private sector and the healthcare systems team. So back on the Paycheck Protection Program, there is a lot of discussion going on about the end date of that program, and I think we are optimistic that there are choices for businesses, but we don't have. That's a federal program. We have certainly weighed in and given our feedback. I think the federal delegation of the state of Maine, the entire federal delegation, works really effectively together to try to make sure the Maine businesses' needs are met. So I think they've heard this concern. Certainly we have as well, and we are all working together to try to come up with a solution, but we don't have one today.
I will turn now to TJ Trimble over at ABC 7. Go ahead, TJ.
Thank you, Dr. Shaw. My question is about the Hope House, and you may well be aware that it often provides services for homeless people. Should the homeless encampments in Bangor be universally screened?
So TJ's question here is about universal screening for encampments of people experiencing homelessness. And TJ, it's a good question. It's something that we've thought about. There have been some early data on screening of not just encampments but shelters as well of individuals experiencing homelessness, and the data are quite mixed. Usually the trigger, the point at which we opt toward going down the pathway of universal screening is when there's an outbreak. The reason for that is what we want to make sure we do is capture folks when the virus has had enough time to replicate in the body and be detected. One of our concerns is that by moving to test folks where there have been no cases and no one has any symptoms, is that there might be a few folks there who do have the virus, but it hasn't reproduced enough to actually be detectable. To put all that a different way, TJ, it's not so much who we test, it's also when we test. And so we're looking at some emerging data that are coming out about the value of universal screening absent any outbreaks, absent any cases, or absent any symptoms. It would be as if we were to test everyone in this room right now. We have to really make sure that if we go down that pathway, we know how to interpret. If we get a positive, we know what to do with that. But if we get a negative, what does the science tell us about how we should think about that person? So we haven't ruled it out. It's not off the table. But it is something that we have to think about really thoughtfully, TJ. And that's just a glimpse of kind of how our epidemiologists and medical doctors are thinking about situations like that. We know that there is a risk of COVID-19 among populations of people experiencing homelessness. There's no question about that. But so it's not so much whom to test, it's when to test them so that we get results that we know what to do with. I'm going to turn next to Caitlin Andrews over at the BDN.
Thank you for taking the call. I have two short questions for Commissioner Johnson and then one for Dr. Shaw. Commissioner Johnson, I just want to double check. It sounds like with this business reopening that they will be asked to self-police if they do the checklist, and there's going to be any state follow-up on that. Can you just clarify that for me? And also, I said that checklists are coming out later tonight, but I was wondering if you could give us kind of a preview about what those measures will look like for barbershops and salons.
Yeah, so the first one around enforcement, again, I think we are counting on this partnership between consumers, employees, and businesses all working to a similar goal, which is opening the economy and keeping everybody safe. And we expect that to kind of continue. Of course, if there were people operating in clear kind of different modes, we'll start with education and work out from there. But our intent is that we'll all work together on moving forward. The checklist. The preview, yeah. The preview is really an interesting question. So what we did was we took incredibly detailed business processes developed in partnership with the private sector And then we looked at how do you modify that process to remove the high risk points, and then took that body of work into a group that is a healthcare team that Commissioner Lambro has stood up, and had them look at the process and help us work through where they see risks, what they saw as alternatives or choices. How do you make things safer? What wouldn't we know from a healthcare perspective that they can add to it? Then we took that back to the private sector and said, okay, what did we just make untenable for you, or not worth it to you, or where are those challenges, and kind of went back and forth from there. We got to a point usually where maybe not everybody was perfectly happy, but that we came to a compromise and an agreement, and then we would lock down those checklists. Things like an example in a salon would be customers waiting in their car until it's their appointment time. Instead of having a waiting room and people congregating there, people will be asked to wait in their cars, and they will either get a text or a call, or somebody will come out and get them. Things like that to reduce traffic. They also include, much more complex things like sanitation and those types of things as well.
Great. And Caitlin, you mentioned you had a question for me too.
Yes, please. I was wondering if you could talk about whether the CDC sees any future in amending its guidance to homeless shelters to avoid keeping people in close quarters, like maybe putting them in hotels. And I was wondering if you could kind of talk about the situation in Portland and why you think that has not become an outbreak, but Bangor has.
So okay. So good questions, Caitlin. So you ask about sort of how we think about shelters for individuals experiencing homelessness. Caitlin, as you're aware, we did also recommend and undertake universal testing in Portland, and we found that there were no positive tests. We did not detect any widespread transmission, and for that reason, we haven't decided to amend our guidance, which is to say to keep beds spaced apart, to keep lanes of traffic as wide as possible, to minimize close interaction, because at least based on the first glance at the data coming out of Portland, what we see is that measures, when implemented and when enacted, can reduce the likelihood of there being an outbreak. Now, you asked the related question of, well, what's going on at the Hope House? And I want to be really clear about something. Measures themselves are not a fail-safe. Abiding by every single measure in the public health playbook is not a guarantee that there might not be an outbreak. Individuals are still interacting outside of the shelter. They're still coming into contact with folks. There is still community transmission that's occurring. And so although the shelter recommendations are, again, they're necessary, but they're not sufficient. A shelter can abide each and every one of the recommendations to a T and still experience an outbreak. A shelter can abide every one of the recommendations as well and not experience one. There's not really a functional relationship, a direct correlation between the two. So it's difficult to speculate why we've seen what we've seen in Hope House, but I want to be clear, it's not because they did or did not abide by any one rule. It really could be a number of other factors. Our disease investigators will try to get a better handle on those factors, and perhaps at some point we'll be able to trace why an outbreak occurred in one and not the other. But I just wanted to make sure everyone was aware that we've got great faith in the ability of each and every one of these shelters to abide the latest recommendations. I'd like to turn now to Steve Betts over at the Courier-Gazette.
Thank you, Dr. Shaw. This is a question for Commissioner Johnson. I've heard from several small business operators, particularly hair salons, saying there's a shortage of supplies such as face masks and hand sanitizers. Is there anything that the state can recommend or advise them on to get these supplies so that they can open safely?
Actually, I'm going to defer to Dr. Shaw on that question, if that would be okay.
So Steve asks about how various hair salons and related businesses could go about obtaining PPE, given that there has been a shortage. And Steve, we acknowledge that's a challenge. What I will say is that the guidelines that Commissioner Johnson has noted are ones that are, although they will be required for any business that wishes to open. Mm-hmm. Our goal is to ensure that any business that wishes to open can do so safely to avoid generating more spread of COVID-19. That's got to be the goal right now as we dip our toes into the water toward reopening. A business that's not able to satisfy each and every one of the criteria on the checklists should think twice about whether now is the right time to open. We are still in the middle of this. We're still reporting tens of new cases every day. We just reported another individual who passed away. So the outbreak is still with us. And so the decision to reopen is ultimately one of any particular business. And one of the preconditions of that is their ability to secure PPE. Now, the supplies of PPE that we've got are ones that, as I noted, right now are going to nursing homes, local fire and EMS, frontline healthcare providers who are in hospitals, working on the front lines at fire and emergency rooms to keep people healthy. That's our current allocation. And so businesses themselves are also out there looking for PPE, and they've got to make sure they can secure those supplies of PPE before they're ready to go down the pathway to reopening. Yeah. Commissioner Johnson?
The one thing I'm going to add to that is we talk about PPE like it's one thing. And the reality is there are lots of tiers of PPE, and there is very specific guidance in the checklist that is intended to not create this supply-demand challenge, right? We are trying to tier PPE appropriately for healthcare workers and the private sector, business community. So those may look very different when you get to the detail. I would encourage people to be, to be thoughtful about this tiering of PPE and really what their needs are. Right, a lot of times people want to get the best of whatever is available, and I think we need to be sensitive to sometimes the best of what's available needs to go to the healthcare community. What meets our needs in the engagement that happens in a private sector and business environment might be different and might be met a different way.
That's right. A lot of times when we've talked about PPE, Commissioner Johnson's right, it's been used as shorthand for one thing, which are N95 masks. And N95 masks are super specialized, require special training and testing, and are really truly reserved for healthcare workers who are interacting with patients who are and might be positive. In another situation, in a business, an N95 mask is not required, and most folks wouldn't have gone through the process. A surgical mask or even a face covering in different contexts may be appropriate. So I completely concur. We really make sure there's different PPEs for different situations, and an ICU is not the same as a commercial business.
Right, and while that's complex, and honestly, 3 weeks ago I didn't know anything about face masks, and now I feel like I know a whole lot more than I ever intended to. There is a chart on the CDC site that gives guidance around masks in general, and each of the checklists is very specific about which section of that chart they're connected to, so that people will know exactly what the healthcare team has deemed appropriate.
Yep. Thanks for that question, Steve. Good conversation. Thank you. The last question today goes over to Megan at WMTW.
Thank you, Dr. Shaw. My question, I kind of have two questions, really. I guess the first one would be for you, Dr. Shaw. You were talking about Tyson Foods being extremely cooperative and moving toward universal testing at this time. Do you have, or are you privy to the information about where the company stands in terms of that? Like more specifically, meaning are there outstanding tests or pending tests that we just don't know about yet in terms of whether they are positive or negative? And then okay, I'll answer.
Okay, I'll just tackle that one really quickly, Megan. We had our first call with Tyson early this morning to make the recommendation moving to formally and officially recommend universal screening of all employees. It's something that they had already been thinking about. We had a follow-up call with them at 1 o'clock, and by that time they had already moved toward speaking with occupational health physicians, trying to get staff, medical workers to the facility to start that process. I'm not sure when it will actually start, but I can tell you in that ensuing 5 hours, they made significant strides in moving toward discharging the recommendations that we had made.
Thank you, Dr. Shaw. I also have one more question, and it really is for both of you, Commissioner Johnson as well. When we talk about the phases, I know it's very fluid, and we're kind of,
looking at different industries differently and whether or not they can open safely, they could theoretically change phases, if you could use that term. But what, in terms of public health policy or public health qualifications or criteria, goes into deciding whether or not a business is in phase 1, 2, 3, and so forth?
Do you want to start?
I'll start, and
Okay,
then
yeah.
I'll ask Commissioner Johnson to take it from there. You know, so I think Megan's question is about how do we think about which businesses should be in phases 1 versus 2 versus 3. And Megan, you know, the way I think about it, and you heard the governor discuss this yesterday on top of that, which is as we move forward toward reopening, it's a lot less about what is essential versus non-essential, which has been the lens through which we've looked at things for a while now. As we move forward, it's more about what can be done safely versus less safe. And for those things that can be done in the immediate term safely, that's where we want to start. For others that may take more time in order to be able to operate and offer services in a safe manner, those are a bit later down the pike. And some of those factors include to what degree they draw congregation, to what degree they may draw folks from other states into Maine. So it really is about safe versus unsafe, as opposed to essential versus non-essential. And that, for me, drives where they land in the tiers.
Yeah, no, I don't really have anything to add to that. I think it is absolutely about this collaboration between the private sector and the healthcare teams to try to figure out what can be done safely, when can it be done safely, how many people would it affect, how many people would go as part of each grouping, because there is some management of the amount of kind of exposure at any given time as well. So there are a number of factors that go into that. Certainly, I think there is there is some fluidity, particularly the further out you go with the stages. There's probably a little bit more fluidity because, again, we are working actively on some of the science solutions to the challenge.
Yep, great. Well, Megan, that was the last question. I'd like to thank everyone for tuning in today. We've reached the time when we've gone through all the questions today. So very much thank everyone for joining us today. We will be back tomorrow to discuss not just the COVID-19 situation, but also some updates from additional of our colleagues. So thank you very much, everyone. We look forward to chatting tomorrow.